Crystal, I think you're muted.
Can you hear me now?
Yes.
Oh, okay. Sorry, my mic was muted. Okay. Again, I'm going to say that again. Hello, welcome everyone. Thank you for joining us this afternoon. I'm excited for you all to be here and learn about the Allied Health Internship program. We want to thank you all for joining us today, and I'm just excited to tell you more about the program and meet our lovely team behind the scenes that are working on the program as well. Before we begin, I just want to remind folks that we will be sharing the materials after the meeting and also the recording of this webinar. And I also want to just give a quick thank you to our sponsors, which is California AHEC, Blue Shield Promise, and Cedar Sinai for sponsoring the program and allowing us to launch this year. I also want to thank my supervisor, Lisa Fisher, our Senior Director of Member Services, for encouraging me to lead this program as well as supporting me throughout the process. So thank you so much. I'm super stoked to be here and tell you guys more about the program. So with that being said, I'm gonna just introduce myself. I'm Cristal Torres. I'm the project coordinator here at CCALAC. My pronouns are she, her, and I've been working at CCALAC for a little bit more over 4 years, almost, or I think it's gonna be 5. I'm sorry, I'm been disoriented with time, but yeah, almost gonna be 5 years, I believe. And with that said, I'm gonna hand it off to Andres to introduce themselves.
Hi, good afternoon, everybody. My name is Andres Sanchez. I'm the Workforce Program Manager. I use they, he pronouns interchangeably. I've been at CCALAC for almost 4 years. So happy to be here and supporting this program. Welcome, everybody.
Hi, everyone. Good afternoon. Thanks for being here. My name is Alexander Gill. I am the Assistant Director of Workforce. My pronouns are he, him, and I've been with CCALAC almost 7 years. And again, excited to have you here and have you learn more about our program.
Thank you. And that was my lovely team. So thank you. Shout out to them. Now I want to hand it over to our program sponsors to provide the remarks. I believe we have Blue Shield in the house. So Sandra, feel free to unmute yourself and kind of introduce yourself and say hello.
Thank you. Can you hear me?
Yes.
Great. Thank you, Crystal. I'm Sandra Rose. I'm the Senior Director of Community and Provider Engagement for Blue Shield Promise. And I just want to thank Crystal and the team for organizing today's informational webinar and then giving us a chance to say just a few words as to why we're supporting this important internship program. Together with all of you, our providers, Blue Shield Promise, we aim to provide that personalized programs and services that addresses not only the socioeconomic, but the cultural and demographic needs of our members. And so to do this, we need to have a diversified and empowered healthcare workforce that can help us deliver on this goal. And so when the opportunity presented itself to support a professional pipeline program for individuals wanting to get into the healthcare industry. And then at the same time, to provide support to our community health centers, who really are the cornerstone of our healthcare safety net system. It was just a no-brainer for Blue Shield. And so we are so thrilled to partner with the Community Clinic Association of Los Angeles County to bring you this amazing opportunity to support students, and in particular, BIPOC students who want to enter into the healthcare field. And by providing them real life experiences through internships, and hopefully they might find a longer opportunity and home at your health centers. And so on behalf of the more than 500,000 members that Blue Shield Promise has the privilege to serve every day alongside with you, I just say thank you, and I hope you take advantage of this wonderful program and opportunity.
Thank you so much, Sandra, and thank you, Sandra and the Blue Shield team for allowing us to have this program. So again, we want to thank all of our sponsors, which is Blue Shield Promise Health Plan, Cedar Sinai, and California AHEC. So with that being said, let's go on with the agenda for today. So we will provide a program overview first, and then we'll provide a the application process for both the clinic and the applicant, just for you all to gain a little insight on who we're trying to outreach. And then we'll also provide program clinic expectation along with strategies for successfully hosting interns, followed by a Q&A at the end. So I really advise folks to hold their questions at the end. We'll make sure to answer all your questions. So feel free to type them in the chat or hold them off, and we'll allow an opportunity for you all to unmute yourself and ask us your questions at the end. So in the meantime, I'm gonna hand it over to Alex to kick it off.
Thank you, Crystal. I'm going to start off just talking about how this program came about and the importance of it being a focus on allied health. So this program really came about from us talking with you all, from us talking to you all in roundtables, through surveys, through our board, and really hearing from you all that there is really a need for more folks from these allied health professions. We heard from our pharmacy roundtable, from our dental roundtable, saying that they need more dental assistants, more dental hygienists. We've been hearing for the last couple of years that we need more medical assistants. So in hearing all about your needs is how we decided to develop this program and then approach Blue Shield with this idea of this Allied Health Internship program. Next slide. And so we understand that the allied health professionals are really the backbone of your health centers. They are typically, some of the first people that your health center, that your patients interact with, right? They're kind of the first ones that they talk to either over the phone or in person. So they really are the ones that kind of take lead in a lot of aspects at your clinics. We also understand that there are a lot of shortages, and that has only increased due to the pandemic. So we want to help with that. And more so, on top of all that, we also want to train the next generation of healthcare professionals. There are a lot of students out there that go through a variety of programs, either through community colleges, through private schools or universities, or through other programs that oftentimes do not know about community health centers. They only hear and know about hospitals. So we really want to expose them to careers in community health and train and connect them to pathways and careers that they otherwise might not have considered before. So we are really excited about this program. And we will let you know more about it in the next couple of slides. So this program will place up to 30 students for this year. So we're doing 30 students in 2023 and 30 students in 2024 with a 100-hour internship at one of our member clinics. And the 100-hour internship is the minimum. There are some students that do have to do more hours because of their field of study. For example, medical assistants have to do, I believe, 140 or 160 hours. And so therefore, their hours would be more than those 100 hours. So 30 students would be placed to do a minimum of 100-hour internship in one of our clinics, either in the spring or in the summer of this year. And we are targeting students that are about to graduate. So those students that are in the last couple of months of their program, those students that only need to do their externship, those students that are about to graduate and are looking for employment. As part of the program, the students do have to participate in 2 workshops. They'll get an orientation, and then we will also cover information about community health center history, customer service, and we will also talk to them about essential skills that they need in order to really be prepared to work in a health center. As an incentive, these students do get gift cards for their participation, and they'll get gift cards throughout the program as they complete certain milestones. At the end of the program, the students will receive a certificate of completion, and depending on how they do and your evaluation of the intern, and if they have met all of your requirements for hiring, they may receive a job offer. We will also plan to do a career fair with the students. So if something doesn't work out with your health center, maybe they will be hired by another one of our health centers. But the goal is that upon completion of the internship, there is some kind of job offer conversation being held. Next slide. For the benefits for you all. Oh, I'm sorry. These are still the benefits for the students. So the students do get paid. They do get a $1,500 stipend that they get paid upon completion of their 100 hours. Like I mentioned, they get a variety of gift cards throughout the program. They get the opportunity to be hired upon completion of their program. They get to learn about community health. Community health is not often part of the curriculum at their programs. So they really get to learn about community health centers, their operations, how they work. And then they'll get a certificate at the end that says that they completed this program, which will be recognized by our program sponsors. Next slide. Benefits for you all for participating in this program. It gets to help you to support you with your recruitment and retention. I know it's very hard right now to find qualified individuals to meet your vacancies. So it's a great recruitment and retention tool. It gives you an opportunity to hire folks. We are looking to hire, to bring on individuals to participate in the program that do look like the individuals that your clinic serve. So we are looking for students of color, students that are bilingual, students that speak Spanish. It's also a great opportunity to precept and lead. Oftentimes we hear from a lot of clinic staff that they really enjoy teaching and they really enjoy working with those new grads and new students. So it's a great way to have some of your staff that enjoy doing that to teach and work with others. There is also a monetary incentive. So for every clinic that participates and for every one student that a clinic hosts, there is a $1,000 incentive that will be given to you upon completion of that student's 100-hour internship. And again, as I mentioned before, it's a great way to train the next generation of healthcare professionals. So these are some of the incentives for you all. My colleague Andres will be going over some of the accepted areas of study and the students that we will have.
Thank you so much, Alex. So just continuing on from Alex's part of the presentation, these are the areas of study that are going to be accepted into the program. So we're looking at medical assistants, licensed vocational nurse, pharmacy tech, health information technology, building coding, dental assistants, dental hygienist, phlebotomist, community health worker, promotora, and substance use counselors, patient care representatives, patient navigator, care coordinators, administrative, like customer service, reception, call center, etc. Undergraduate majors. So we're looking at community health, health education, social work, health administration. So these are some of the areas that we feel there may be some needed support at your clinics with these roles, and these are positions that typically have a pretty large turnover. So if you are unsure of any majors or areas of study that are accepted into the program, you can reach out to us at recruitment@ccalac.org, and we can answer any of those questions regarding any specific majors. We can go to the next slide, please. So here are some of the applicant requirements, just for you all to get an idea of the folks that we will be accepting into the program. So they will be required to submit an application, and the application is pretty thorough in terms of asking questions about their expectations regarding, the program, the internship. They must be 18 years old. They will be required to attend 2 virtual workshops, sort of like an orientation that we will provide to them. In an ability to complete about 100 hours in-person internship, so approximately between 15 to 20 hours over a week over the course of 5 to 6 weeks. Availability of Monday through Friday for internship hours, so to make sure that they're available during the times that your clinics are open. That we are focusing, trying to get folks that are bilingual Spanish, not required, but it's a plus, or even considering other languages depending on the needs that you have at your clinic. Must be able to do internship hours between the hours of 8 to 5, must live in LA County, have reliable transportation, must be in the last 4 to 6 months of our program area, of their program area, or study and have recently graduated. So we want to make sure that these are folks that are going to be ready, to step into the workforce, to be able to do that internship and potentially be hired at your clinics. And then must be in one of the accepted areas of study that I went over in the last slide. We can go to the next one. Also, we are informing them of other potential requirements for the clinic placement. So they do understand that they might need COVID vaccination or proof of vaccination, obviously due to the nature of the roles or access to interaction with various, patient populations. They might even need a TB test, a physical immunization records and things like that. So these folks will understand that these might be things that might be required of them to get, all of this ready if they plan to apply for the program. Must pass a thorough background check, any other clinic requirements that might be, individual to your sites, to your clinic sites. So we will make them aware of all of those things ahead of time for them to prepare. If we can go to the next one. So the applicant program application. So this is what we're asking in terms of, the application. So demographic questions to get a little bit more of their background, their area of study, to make sure that they are fulfilling the requirements in terms of the different areas that we're covering. Personal insight questions are, why do you want to work in community health? So really getting folks that have a passion for doing this work, want to, support community, want to help community. Tell us about your experience working with diverse community-based populations. So because of the nature of the different clinics throughout LA County, as you all know, you work with various populations. So we want to make sure that we have folks that are experienced or have some knowledge of what it's like to work with these populations. And then working across ethnic, racial, and cultural differences. That's really important. Again, you work with a variety of different folks in your community. So we want to make sure that the applicants understand the different, folks that they might come across at your clinics, and a resume just to kind of get a background as to their experience, and then, maybe areas that they might need strengthening in. Next slide. And then for the clinic program application, so this is the application that is for you all, that if you're interested in applying to be a host site, we will be asking for clinic contact information, Allied Health Interns requests, so the number of interns that you might be needing at your clinic, your clinic availability, maybe how soon you are, looking to host folks, the type of intern, the intern responsibilities. So what will folks be, working on? What are the projects or, programs and things? So more specific, so that we could try to match the interns best to your needs. Preceptor contact information. So there does need to be someone that will oversee the intern. Who will that person be? So that way we have that contact information ahead of time. Clinic site locations. We know that you might have more than one location that you need interns at. So we just want to make sure that we are also taking into consideration location based on where, the interns may live. So, different locations if you need interns for different sites, any special requirements that you wish for us to consider. And then we do want to note that we will do our best to accommodate your requests, but we cannot guarantee all of your intern needs, just depending on the number or, the diversity of interns that we may get to apply for this program. But we're willing to work with you to get, the best person matched to your site. And I'll hand it over to Crystal, and she can finish us off on the rest of the presentation.
Thank you so much, Andres. Yes, so now we'll discuss the program timeline. So as you all may know, the application is already open for both the clinic and applicants. So application is open, and right now we're conducting so for most of the month of February and maybe a little bit in March, we'll be conducting interviews. And we're also outreaching to our applicants, but the application deadline for both the clinic and the applicant is February 28th at 11:59. And again, we will send acceptance letters during March, and the program will begin on April because our didactic training will begin on April 13th, the first workshop, and the second workshop would be on April 20th. And then after the second workshop, folks, depending on their availability, they can begin their externship hours. So again, externship begins on a rolling basis, but it will happen right after the second workshop. Either it could be in April or the following month. So the externship will end on a rolling basis. Again, it depends on the availability of the applicant or the intern. And then we will have the program ending sometime in late summer or early fall. And we'll have a lovely graduation ceremony for all of the interns and folks who participated in the program. So that's the program timeline. Next is the program clinic expectations. So these are the expectations that we have for the folks who are participating in the program. So we want folks to complete the MOU by the deadline. And we also want clinics not to hire the intern until the end of the program. There's an expectation that the interns must fully complete the program to be hired. So we really want clinics to not hire them until the end of the program. And we also want clinics to designate a committed supervisor that has the availability to precept the intern. We really want the intern to have a great experience, and having a committed supervisor is essential for them to really optimize their experience and kind of gain a mentorship through that supervisor. We also want the clinics to maintain communication about any intern challenges and successes with us. We want to make sure that the intern is also completing the applicant expectations as well. And also we would want to learn any successes if you're having a good time with the intern. So we really want to get that feedback as you are hosting these interns. We also want folks to accommodate the externship hours for the applicant's field of study. So as you know, we have a diverse pool of field of studies that we're looking for an applicants, and many of their programs have different externship hours that they must complete. For example, medical assistants, I believe most programs requires them to complete 140 hours, and I know our program only requires 100, but if they can complete those 40 hours at your site, please allow them to complete it just because they need it to get their licensure. So we really want folks to accommodate the externship hours for the applicant based on their field of study. And also, we want folks to create an onboarding plan with resources and tools for them to succeed within their role. A good onboarding plan would allow the intern to really succeed in their role by creating that plan. And again, we want folks to optimize the intern's experience. We really want you to treat it as a long interview process. It's both it's a chance for both clinic and intern to kind of get to know one another and see if you guys are the right fit throughout the program. And again, it's a mentorship opportunity for the intern and also for the preceptor. As Alex mentioned, a lot of folks who precept really enjoy leading and teaching. So it's a great opportunity for both parties to just have a successful experience within the program. And again, just complete the evaluation at the end of the program to receive a $1,000 incentive. So those are the program clinic expectations. Now I'm going to go over a few strategies for successfully hosting interns. So as mentioned earlier, give them meaningful responsibilities. Folks who intern at places really want to be part of something. And again, these folks are ready to work, ready to learn, and they're green in their field. So they really want meaningful responsibilities and kind of be part of the team. Write a clear job description. Really be clear on what you need them to support you all in your clinic needs. Also treat it again like a long interview. It's a chance for both parties to kind of get to know each other and see if you guys are a right fit. And then make the payoffs clear. Make sure you focus on clear goals. Be flexible again. These folks, some of them are completing their studies, so they need you to be flexible in order for them to complete their hours. Find out what motivates them. Make sure you can keep them and retain them. That's the goal of the program. We're aiming for folks to be potentially hired after and be part of your team. So we really want you to guide them to success and treat them like a future member of your team, because again, these folks are going to be ready to learn, ready to work, and just really ready to learn about community health and just be part of a team within healthcare. So these are like some few strategies for successfully hosting an intern that I just wanted to share for anyone who hasn't hosted an intern before. So with that being said, I hope that encourages you to apply now. Again, the deadline to apply is February 28th at 11:59 p.m. That's the application link. And again, all this information will be sent to you all after the meeting. And now, I guess now it's time for Q&A. I'm not sure if there was questions in the chat, but let me see if there's any questions. I don't see any. But feel free to unmute yourself. Oh, I see Bianca Gonzalez raising their hand. So feel free to unmute yourself, Bianca, to ask a question.
Hi, everyone. Good afternoon, and thank you so much for this meeting. It was really informative. I just have a couple of questions, actually. So the first one, if we were interested in hosting an intern, would the initial pre-screening, as far as like their health screenings, their physicals that they need to get done, verifying if they're updated with their vaccinations, is that a cost that we, the organizations, will be taking on, or will that piece of the recruitment process be taken on by you guys, by your group?
So I believe the pre-screening, when it comes to like the immunization records, that's going to be taken on by the clinic. We will do our best to match you with the intern that best fits your needs. That's how we will do it. But we'll basically, the whole onboarding process, that would be up to the clinic.
Okay, so let me see that if I'm understanding correctly. So as far as the health screenings for the intern, that is something that we would have to take on. This wouldn't be something that you guys would be doing.
Yes, we are
Okay.
going to be asking them if they're like COVID vaccinated beforehand during our pre-screening process, but for them to provide like the actual proof, that's going to be up to the clinic, like onboarding process.
Okay. Okay.
Yeah, and we are providing that $1,000 incentive to all the clinics for each student that they host.
Okay, so the $1,000 incentive, that's per intern that we take on, assuming that we take more than one.
Correct.
Got it. Okay. And then my next question is, you mentioned in the presentation for us to hold off on hiring any of the interns until they finish their time. So let's say that the intern maybe didn't perform in the way that the reporting manager had expected or would have liked. They're not required, right, to hire them after the fact, right? If the performance wasn't what they had hoped it would be.
Yeah, you're not required to hire them, and they also know that as well, because we want folks to kind of like best fit your organization. So again, it's a potential for them to be hired. Like that's their payoff in the end. But again, you're not required to hire them if they're not the right fit for your organization.
Got it. Okay.
Mhm.
Thank you very much.
Yeah, thank you for those
And we
lovely
will have,
questions.
just to add to that, we will have an evaluation that will have you complete at the end. So you'll let us know why the student wasn't a good fit, and we will make sure and communicate that to the applicants to let them know why they were not why they were not extended a job offer.
I see. So then the evaluation piece, this wouldn't be something that the reporting manager would be going over with the student. It would be someone from your team going over with them.
Yeah, ideally, if they can go over it with them, that'd be great. But if not, we will make sure and communicate it from our end.
Yeah,
Got it.
thank
Got
you
it.
so much.
Thank you.
I believe Constance hand was raised. Feel free to unmute yourself.
Yes, good afternoon. I thought my question was going to be answered, but I guess it's an extension of Bianca's question regarding the responsibility of CCALAC and the clinic. And that is the background checks or any live scans that are required. That's on the clinic. Is that the clinic's responsibility? Or do
Yeah,
you have some sort of a background that you have for vetting the candidates?
no, that's up to the clinic because it's not required for our program, but those are potential requirements for the clinic site, like placement site. So that's going to be up to the clinic.
Okay. Is there any process that you have besides interviewing to select the candidates?
Yeah, just interviewing and going over like their application and matching also the clinic application, but based on like the site needs.
Okay, and then one more follow-up question, and I think I already know the answer to this, but the stipend that the students get, does that come out of the grant that you give to the clinic, or that's separate?
That's separate.
Okay, thank you so much.
Yeah, of course. Thank you. I guess the next person whose hand is raised is Manisha. Hopefully I said that correctly.
Yeah, hi Crystal, thank you.
Hi.
Thank you all for the presentation. In regards to a clinic site having multiple internship opportunities in the application process, is it one application per intern opportunity, or is it one application and in the application you can list out the multiple internship opportunities?
Oh, so in the clinic application, you have the opportunity to select which area of study you wish your intern to be to have, and then you can kind of there's a like an open-ended question where it's asking about responsibilities. That's where you can kind of say like, oh, I need a dental assistant to do this. I need an LVN to do this or that. So it's only one application for you to capture all the your intern requests.
Okay, thank you. And then in regards to, putting together the job description, can we use our internal job descriptions that we already have? Or do you want us to tailor this specifically because we're already putting together an onboarding plan for the intern? Do you want us to create a separate job description specifically for the intern?
For the job description, you can be as detailed as you wish. We just kind of want to know what type of job requirements or the intern's gonna be doing. For example, some of the areas of study we have are also undergrad majors, so they're probably going to be curious what exactly they're going to be doing during the program. So it can be as detailed or as not super vague, but like you can be like they're going to be supported by this and that. Because I've received already some applications and some clinics are already like super detailed and others are kind of not as detailed, but as long as there's like a responsibility attached to that question that we have.
Yeah, if you already have job descriptions, feel free to use that. Like,
Great.
if you already know
Great.
they're going to be a back office MA or front office, you can utilize what you already have.
Great, thanks for that. That's really helpful. And then again, if we're requesting multiple or if we're submitting multiple opportunities, but at different sites, again, that's okay. It's not like confined to one site. If an organization has multiple sites, great, thank
Yeah.
you.
Yes. And the more information you give us, the better we are able to match you on the student or intern you're looking for. So yeah, so try to be detailed or, as specific as possible, because it would help us also communicate that to the potential candidate.
Great, thank you guys. Thank you all so much.
Yeah, of course. Thank you for these questions. These are great questions. I think there's other questions on the chat. Will orientation and training time, such as HIPAA training, be included in the computation of the 100 hours? I believe so, right, Alex?
No, the HIPAA will be outside of the 100 hours.
Oh,
So
they'll be
we'll
outside.
make sure and that they get HIPAA trained before we send them to your clinic.
Thank you, Alex. And then the next question is, we have multiple clinic sites. Could we place interns at multiple clinic sites? Yes, just please specify that in the clinic application so we know and we can communicate that to the potential candidates. Are there any other questions, comments, concerns? Now's the time.
Sorry, one more question. In regards to, the supervisor or mentor who's precepting, sometimes in a clinical area, the interns may be rotating with different providers or different dental assistants, different MAs. So you're asking for a committed supervisor or mentor. If within the organization, we have, like, for example, an AMD of education or someone who kind of oversees a lot of the educational roles or things like that, can you have one person oversee multiple interns, and then within each department they're rotating amongst different clinicians or clinical staff or MAs or front desk, whoever it is within that department? Or does it have to be the same person throughout their whole 1,000 hours?
It's 100 hours, but we would like
Sorry, 100
for
hours.
the preceptor to have at least one lead. So that person, if the intern ever has questions, they can always connect with that preceptor, and also that preceptor communicates with us as well. So as long as there's a lead, like a preceptor lead, you should be fine. I hope that answers your question.
Yeah, that's it. I mean, the background on that is, of course, all of us are dealing with workforce shortages and, staffing and stuff. So there may be days where, interns may be rotating with different, providers or different staff members. So just, but of course they will have someone that is supervising them. So, but they may not be with them every day. So just ensuring that committed supervisor mentor doesn't need to be the one doing all 100 of their hours. They can gain experience from other staff members and things like that.
Yes, of course. We encourage that, since if that's mostly the culture of you're working in a team-oriented space.
Great, thank you.
Are there any other questions? Oh, yes, Constance?
So did I hear you say that you're capping the program at 30 interns?
Yes.
Okay, so is there anything that would disqualify a clinic, or how will you choose if you get a plethora of applications? How will you, what's your selection process there?
As of the moment, since it's kind of a new program, we're kind of rolling with what's going on or how many clinics apply to the program. So right now we do not have a cap of how many clinics can participate in the program. We just want folks to apply, and based on that, we'll see how we can match folks to at least have one intern participate. Let's say if we have 30 clinics, we'll try to have one intern per clinic. for our member clinics so they can participate in the program. I also know that there's also discussion based on the applicant pool that there might be like different cohorts. Because again, based on I know different there's different allied health programs and they all have like different graduation dates. So we might have a cohort end earlier or another one later. So again, we're kind of rolling based on like the applicant pool that we have, and the more information we have based on who's applying, we can flesh those details out. But right now it's open, like we don't have a max for how many clinics can participate. Right, Alex?
Right. We definitely want to welcome
you.
all of our clinics and encourage you to be open to as many of the different fields of study. I think I would say the only thing that would discourage a clinic from participating or would eliminate them would be if we are just not able to match anyone with you, you know? Again, we're going to try our best, but we understand that these folks all live in different parts of LA County and their willingness to travel is limited. You know, we are encouraging all of them to expand how far they can travel, but that is limited. So we're just going to try our best to match everyone.
Thank you.
Yes, thank you for that question. And then there's another question saying, also to confirm, you said it's 1,000 for the clinic for the health center per intern. Yes, 1,000 per intern for the clinic. Is there any other question? Constance, I don't know if your hand is still raised. Did you have a follow-up?
I did not, sorry, putting
Oh,
my
okay.
hand down.
Oh, no worries.
I had a real quick question. This is Matt from Northeast Valley.
Hi, Matt.
Will we be sent a copy of this presentation?
Yes.
I definitely want to take this and bring this to our executives and stuff like that, and I think they'll be very excited about it. So, and they're going to ask all the questions that you've already answered in this presentation. So this way I'll be prepared.
Awesome. Yes. Presentation slides plus the recording will be shared to you all. And it would also be on our website, but it will be password protected. But yes, I will share the links to you all after this meeting.
Thank you so much.
Any last minute questions? Now is the time. If not, that's my contact information on this slide. Feel free to contact me if you have any questions that you can in the future. And I'm going to repeat again, I'm going to share the slides as well as the recording to you all after the webinar. So I don't see any questions coming in. So I'm going to give you all back 13 minutes of your time today. So thank you so much again for joining us, and we hope to see your application. And I'm really excited again for this program and for helping you all with your workforce recruitment and retention efforts, specifically for allied health. I'm excited again for the pool of applicants that we're going to get. I'm optimistic we're going to get a nice diverse pool. Alrighty, so thank you so much, everyone. I hope you have a lovely day. Take care and have a good one.